So how does the Part D prescription drug coverage work? There's 4 tiers of coverage, and for the year 2015, these are the values associated with each of those 4 tiers of coverage. The first tier or step is the deductible, and this year it was up to $320. And there were some cards that had a zero deductible and some that were up to $320. But that's the first step when we look at the coverage when it comes to Part D. The next step is the initial coverage level. And this is based on the total retail cost of drugs that you're taking. And in 2015, that was up to $2,960 based on the retail cost of the drugs. So while you're underneath that initial coverage level, you're paying the co-pays or co-insurance for the drugs that you're taking. If you happen to be paying more than, or if you happen to be taking drugs that cost more than $2,960, again, this is the retail cost of those drugs, then you move into the coverage gap or the donut hole phase. And this is where you really spend a lot for your drugs. It's up to 45% the cost of a brand name drug and 65% the cost of a generic drug. So you really want to avoid this coverage gap if you're able to, and stay underneath the initial coverage to avoid this expense for drugs in the coverage gap. There is some protection on the other side of the coverage gap called catastrophic coverage, and that's if you've spent over $4,700 based on true out-of-pocket cost. So this is, you've actually spent the $4,700, where the initial coverage is based on retail cost of the drugs, not what you've spent out of pocket. So if you do exceed the $4,700, then you're protected by catastrophic coverage, where you'd only spend the greater of 5% the cost of the drug, or $6.60 for a brand name drug, or $2.65 for a generic drug. So there is some protection, but again, you've already spent $4,700 at this point. So you've already spent a lot of money before you get that benefit of the catastrophic. There are some changes coming in the year 2016 as it relates to Part D, and it's on this slide in orange are those changes. First, the deductible goes up from $320 to $360. Again, there's some cards that don't have any deductible, so you can still have a zero deductible, but the maximum that they could have is up to $360 during that that initial phase. Initial coverage level is going up $350, which is a good positive story. Again, last year was $2,960, and then going into 2016, it's $3,310 based on the retail cost of the drugs. So as long as you're underneath of that, you're just paying co-pays and co-insurance for the drugs that are on the formulary for your drug plan. The coverage gap goes up to $4,850, so you do have to spend more in the coverage gap before you get to catastrophic next year. But it's it's a $150 increase versus the $350 increase on initial coverage. Also, the cost in the coverage gap for your generics goes down from 65% to 58% the cost of the drug. These numbers will continue to both go down, 45% and the 58% will go down to the year 2020 when they're both going to be at 25% for brand name drugs and 25% for generic in the coverage gap. So that's another good news story, that the cost is going to be reducing for the coverage gap from now until the year 2020. Now, I just want to go through a quick example so you can see why this is so important, that you analyze the drug cards that are out there and that you pick the right drug card for your specific drug list. So we had an individual come into the office years ago, about 10 years ago, with a drug card situation with lots of expensive drugs. And this is the list of drugs that he was taking. And he also had a neighbor that was on a card that they really liked, and it was about a $40 a month card, and he really wanted that card because his neighbor liked the $40 a month card. And what we told this individual was, we really got to look at your specific list of drugs and make sure we get you the right drug card. So we entered in all of his drugs into Medicare.gov as a tool where we can do this analysis and determine what the best drug card is. And the best card that came up was this card here. It's almost $100 a month in premium, but it was the best drug card based on the total annual cost for his premium plus drugs. So that's the way this tool analyzes, is looking at total cost that takes into account the premium for the card plus the cost of the drugs. So we told the individual this was the best card, and still we got some pushback on, I want the $40 card. That's what, why would I pay $100 a month when I could pay $40 a month? And again, this card was going to cost him $4,800 a year, total annual cost, but this was the least overall cost for the year. So we looked at the next card, which was, we looked at the $40 card, $39.20. The total annual cost for this card would be $12,800. Okay, so it's an over $8,000 mistake if he went with this card. And the reason was 3 of these drugs were not covered on the formulary for this card. So he's paying the full retail cost of the drug in each one of those phases, the initial coverage, the coverage gap, and catastrophic. He's still paying full retail cost in each of those phases. So it would have cost him, again, $12,800 for the year if he had gone with this Part B, this card numbered letter B, rather than the first card we looked at. We also looked at one more card. We sorted the list to see what the most expensive card for the year would have been, and it happened to be another almost $100 card, but there were 4 drugs that were not covered. This one was also not covered, this gel, and his total cost for the year would have been over $16,000. So the big takeaway from this example is you really have to look at the total annual cost, not just the monthly premium for the drug card. You got to look at what the cost of the drugs is going to be, what's included on the formulary, to determine what the least overall expense will be for the year. So that's really important, and it's, again, the number 2 biggest mistake we see is people that are not selecting the right drug cards. The number 5 biggest mistake we see, which you see on this slide, is people that are listening to their friends and family, and just, my spouse or my cousin or my brother has this card, and that's the card that I want to go sign up for, and it may not even cover your drugs. So the big takeaway is make sure you do this analysis every year. Either do it yourself if you have a broker that can do it for you, or a family member that's comfortable using the internet that can do this on Medicare.gov. We do not suggest calling a specific carrier because they're just going to tell you the best cards that they have to offer, where Medicare.gov will tell you all of the cards that are available in your state. So that's it. Hopefully this was helpful for you, and you could watch the next couple videos on how to use the tool on Medicare.gov to see a couple of examples.